I think the first thing to tell you about the School of Medicine at Keele is that we're young. We had our first students in 2002, and they were actually Manchester students. We then developed our own curriculum, which started in 2007. So our first Keele graduates were in 2012. By UK standards, we're small, which I think means we can be very personal. So we have 650 undergraduate medical students, which means 130 per year. One of the things about being young is that we've got excellent facilities because they're all purpose-built. And this starts with our medical school on campus. So Keele itself is a campus-based university. We have a medical school building, and in that building we have state-of-the-art facilities. We're perhaps most proud of our anatomy facilities, which include the ability for all students to undertake dissection. We think that's an excellent way to learn anatomy, both as an undergraduate and also as a postgraduate, particularly for surgical trainees. But we also have other excellent facilities in the medical school. They include the IT facilities, the seminar rooms, and our lecture theatre. And these excellent facilities stretch beyond the campus. So as it happens, our major teaching hospital, the Royal Stoke University Hospital, has been completely rebuilt in the last 5 years. It includes new education facilities, including a clinical skills lab. The other hospitals we use have also had newly built clinical skills lab. And we also have over 100 practices, which again have excellent facilities, including the ability for students to see patients on their own in consulting rooms. And the final thing I think to know about Keele is that we pride ourselves on engagement with the community. And that's a university ethos, which is also embraced within the School of Medicine. So, of course, that contact with the community includes the student placements. But it also includes student activities within the voluntary sector. A lot of our students get involved with voluntary organisations. We have a number of student-led student societies which are committed to helping the local community. And then finally, a number of our graduates, quite a lot of our graduates in fact, choose to continue to work locally once they do graduate. I think we've got several things going for us, some of which I've already mentioned. The first is our facilities. We've got excellent facilities for lab-based learning, for classroom-based learning, and also for clinical learning. So within our hospitals, within our general practices, things have been designed to accommodate students. So excellent facilities is one reason. I think the second reason for studying here are our placements. We have over 100 weeks of clinical placements, which would make us one of the higher placement areas in medical school terms in the UK. And during those times, students spend time in the local hospitals, in local practices, autonomously interacting with patients. And particularly as they progress through the course, they get the ability to spend more and more time with patients on their own, but under appropriate supervision. As a small school, we are responsive to students, and we think that's very important, and we pride ourselves on that. So not everything that we design is perfect, but we do expect to respond if things aren't working as well as we would expect. So we have very good engagement with students. We have a student council, we have a lot of evaluation done by students, and we have things like a student away day, where we listen to what the students tell us about how things are going, and we expect to respond to that. And then finally, and perhaps most importantly, we think our graduates are prepared to practice effectively as doctors, and we have evidence to back that up. So we do well on various external metrics, including preparedness for practice. So the General Medical Council oversees surveys of all UK graduates to ask them, when they've been working for 3 months, did they feel they were adequately prepared for practice? And Keele scores well in that. There are also surveys done of consultant supervisors of these newly qualified doctors to ask them if the graduate's prepared. And again, Keele has scored well in that. We score well on the National Student Survey, which is what students feel about their experience at Keele. So again, I think the most compelling argument is that our graduates are ready to work as doctors. I think it's quite simple, really. There are two reasons why we like international students. The first is that we believe that we can offer a high-quality education for international students. I've said a number of the reasons why. So we believe that we can enable international students to become good doctors, whether they ultimately work within the UK or whether they go back to work elsewhere in the world. So that's one reason. But the second reason is more selfish. We believe that international students bring something extra to our course. And that extra is both to the students who take part in the course and also to our staff. They bring a different perspective, they bring some different expectations, and these are healthy things for us in running a medical curriculum, particularly in an age where global health is increasingly important. So unashamedly, I would say that we believe having international students on our course enhances the course.